And today she is going to talk with us a little bit about the article that I shared with you all last week, which is about the topic of suicide and ADHD. So Christy, I'm going to let you take it away. And thank you so much for being here and helping us learn about this topic this morning.
Great, thank you. So, and my cat will be joining me too. He is my co-counselor often, so he's right here front and center. So
Awesome.
Thank you
What's
for
your
having
cat's
me.
name?
This one is Milo, so there are a
Milo.
couple
All
that
right.
will potentially show up. So yeah, it's
Animals
the
are
benefit of
always
working
welcome.
from home. So thank you for having me. I was really pleased to be invited. And when I was talking to Patty about what some of the topics that we could go over, one of the things that I've been reading more about is the intersection of ADHD and suicide. You know, we spend a lot of time talking about suicide in relation to major depressive disorder and anxiety and bipolar, but one of the things that does not get talked about a lot is ADHD. And the first half of my career, I started out as a child and family therapist. So obviously, a big chunk of my time was working with children and adolescents, teenagers who struggled with attention deficit hyperactivity disorder. And so I had an affinity for ADHD throughout my career, but even more so, I have a brother who is less than a year younger than me. We grew up very, very close, and he had pretty significant ADHD diagnosis. And so growing up with him and watching him really struggle with a lot of the symptoms that kind of go along with somebody who struggles with behavioral problems, you know, social ostracized, I can never say that word, being ostracized socially, you know, never feeling good enough, really struggling with some learning disabilities, and then constantly having this sibling comparison. It was always a really, really difficult thing. And then watching him grow up, and he's wildly successful. He's, you know, learned to compensate for some of those difficulties, and he's an amazing person. He has a great family, and but even still, all of these years later, a half a century later, he still struggles with a certain level of imposter syndrome. And so, you know, those symptoms that go along with ADHD play a part in why there's a prevalence of higher rates of suicide in people who are diagnosed with ADHD. And in fact, people who are diagnosed with ADHD have a 2 to 6 times higher rate of suicide, of dying by suicide, than people who are not diagnosed with ADHD. And that's a pretty significant difference, considering that ADHD is not considered a mental illness. It's just a neurobiological disorder. So that was really interesting to me. So that's kind of a little bit about, you know, where my interest in ADHD and why I kind of really wanted to touch on this topic. Just to start out a little bit about the prevalence, I just wanted to give some statistics about the prevalence of ADHD. And there's a sort of an interesting drop off, and we'll see what your thoughts are about it. About 2% of 3 to 5 year olds are diagnosed with ADHD, 10% of 6 to 11-year-olds, 13% of 12 to 17-year-olds, but only 3 to 5% of adults. And that's an interesting statistic for me, because if you've got 2, 10, and 13% of children, what's happening to all of those children who have been diagnosed? What's happening to them as adults? And as I was reading about it, a lot of it is that a lot of adults grow out of their symptoms, and so they leave their diagnosis behind. Or, like my brother, they've developed some compensatory behaviors, and they no longer meet the criteria. And so, or a lot of people still sort of have a belief that that ADHD is a child's diagnosis, and it's not something that is a diagnosis for adults. And so I think that that's a big part of what that drop off is. Um, The other thing I want to talk about before I go into the intersection between ADHD and suicide is just touching on, I'm not real sure what everybody's background is, and what role everybody has in terms of, therapy or diagnostics, but I wanted to briefly touch on the three subsets of ADHD, just to kind of give a little bit of an idea, about how it presents itself to different people or in different people, because it actually makes a difference when it comes to the research. So obviously there's the presentation, the hyperactive type, which is the presentation that most of society kind of identifies as ADHD. Those are the people who really have a hard time sitting still. They are super impulsive and restless. They're the people who generally, especially children, maybe have some more behavioral problems. So their behaviors are much more out there and noticeable. The second type or the inattentive type. Those people maybe don't have such outward behaviors, but they have much more difficult time paying attention, really disorganized thinking, or hard to finish tasks, paying attention, keeping track of conversations, following instructions. So there's a little bit more internal. And then the third type is just the combination of the two. It's the lucky people who get both. And that's a really, really challenging situation for them. So that just kind of gives you a very, very brief sort of background. So that's where I want to bring up the article that I sent. And I'm not going to read through it because it is endless amounts of statistics. And you guys can obviously go through them at some point on your own and read through it. But this was a lit review that compiled about, I want to say it was 604 different research papers, international, to kind of compile what they found the basic statistics were for ADHD and suicide. And what they found universally was that there's a pretty significant correlation between an increased suicidal risk with people who are diagnosed with ADHD. And that seems to be true regardless of country. And lost my train of thought. Yeah, so there are a lot of statistics there, but I did pull out some that I thought were really important that I wanted to talk about a little bit. 4.2%, I'm going to read these off because I'm not going to remember these. 4.2% of ADHD kids have had a suicide attempt, and 8% have had a suicidal ideation where they've just had really intense thoughts about taking their own life. And those rates are higher in the combined type of ADHD, opposed to either specifically the inattentive or the hyperactive type. And that was interesting to me too, because I was kind of thinking that potentially the impulsivity factor of the hyperactive type would be a more prevalent, that would play a bigger part for suicidal behavior, but apparently not. The combined type is the one that has the higher prevalence. Kids with attention deficit, ADHD, and comorbid oppositional defiant and depression have an increased risk factor for suicidal ideation and attempts. But interestingly enough, if children have a comorbid anxiety disorder, they have a decreased risk. Their anxiety disorder seems to work as a protective factor, much in the way that their basic fears, there's a fear of potential pain, of what death will be like. There's the fear of disappointing people. All of the anxieties that everybody struggles with seems to work as a protective factor for kids with ADHD and anxiety. There was a really interesting study. It was a 13-year longitudinal study that showed that kids with ADHD, the hyperactive type, were twice as likely to have suicidal ideation and 7 times more likely to attempt suicide. That was a shocking statistic for me. Because again, I think, and having worked in schools for years and years before I was in private practice, there still is this assumption that kids with ADHD are just kids who struggle with, sitting still and following directions. And this idea that they're really kind of struggling with some emotional things too is really getting missed. And that's really problematic, especially if we're talking about them having a 7-time more likely risk of taking their life. There was another study that focused primarily on girls with ADHD, and it showed that girls with the combined type of ADHD were more likely to engage in self-harm and or suicide attempts versus girls with the inattentive type. So this combined type of ADHD seems to be a bigger risk factor than either the inattentive type or the hyperactive active type alone. One of the speculations about the disparity in the girls with the hyperactive type having a harder, because there was part of the study was that girls with the hyperactive type had a higher rate of self-injury, although they had a lower rate of death by suicide. And one of the reasons that they speculated that was that girls who struggle with the hyperactive type face more social difficulties. Generally, boys are more regularly diagnosed with the hyperactive type, and girls are more often diagnosed with the inattentive type. And girls are very often not diagnosed at all. They kind of fall through the cracks a lot. So when a girl is diagnosed with ADHD hyperactive type, the behaviors are so outside the social norm that they face a lot of social ridicule sometimes, and that will sometimes lead to some self-harming behaviors. Another statistic is about 16% of adults with ADHD, 16% made a suicide attempt, and having ADHD puts your risk at 1.5 times over those without ADHD, without an ADHD diagnosis. 16% of people with this diagnosis have attempted to take their life, and that is a pretty significant percentage. Another study showed that the incidences of death in adults with ADHD are 5 times higher than those without ADHD. And a big part of that is the impulsivity. And I'm going to talk about that a little bit in a few minutes about why that is. So I'm going to put that on hold a little bit. One of the most startling studies that I read was a study that was conducted in emergency departments with kids who were in the emergency department for suicide attempts. And what they found was that 65% of children who were in the emergency room for a suicide attempt, these were kids between the ages of 12 and 18, had ADHD, but only 22% had previously been diagnosed. And this is the interesting part. Of all of the kids that they studied that were in the emergency room for a suicide attempt, ADHD was the number 1 diagnosis. Depression was number 2. And so this was a really surprising thing, because we're missing something here. We're missing something. This is, we all assess for depression. We all do our PHQ-9s and we do our GAD-7s, and we, assess for those things, and we assess for suicide, but we're not really assessing for ADHD and what role that plays for people. And I think that that's something that we really need to do as clinicians. Is this something that somebody is struggling with? So how do we make sense of this? How do we make sense of these startling statistics and this intersection between suicide and ADHD? I know we talk a lot about suicide and a lot of the theories of suicide. I think most of us kind of subscribe to Thomas Joiner's theory of suicide, and with the 3 main factors of thwarted belongingness, that feeling of just not fitting in and not belonging anywhere. The second part of perceived burdensomeness, where you just feel like a burden, and that you're just in everybody's way. And then thirdly, the acquired capacity to take your own life. So think about those three things within the context of somebody who is diagnosed with ADHD. You've got a teenager or a child or an adult even who has struggled with potentially behavior problems, learning disabilities, social relationships, can't quite fit in, don't really know how to do things the exact right way, learn in a different way, and they can't quite figure out how to belong. And at the same time, they're hearing messages from their parents about if you just try hard enough, if you just apply yourself. And they're hearing the same sort of messages from their teachers. And they're kind of feeling a burden because they're trying. They're trying very hard, but they're feeling a sense of being a burden to their family because they can feel the disappointment. And then as they get older and have the capacity to start to conceptualize how to take their life, you have this sort of perfect storm where things can go very bad very quickly. So,
Christy, real
yes, ma'am.
quick, Chris has
Yeah.
his hand raised, so I think he
Oh,
might want to interject and ask a question on that note. Chris?
sure.
Hey, yeah, and really, it was something actually I was thinking about as you were speaking about it. Like you kind of mentioned in terms of family, and I think that having a little experience with this, one of the other things to keep in mind is that there are compounding factors among the various peer groups and/or social groups one might move between. And I think, most simplistically, youth aren't necessarily going to have a workplace group per se. They might, but and so like whether that feeling of isolation can be compounded based on the number of peer groups or social groups that person interacts with that end up where those groups might the person that feels like they don't fit in, right? So it could be across the workplace and through I think about interesting personal experiences with teams, right? And or like band or all those different. They're not. I don't want to say cliques, but they're sort of like social. They're
Mhm.
socially distinct like
Yeah.
groups. And I think what I observed sometimes with friends is that they would have, of course, some positive interactions, negative, as everybody's going to have. But the more times they would find a place right in one of those and feel accepted
Mhm.
in one of those groups was a generally a good thing. And the people that I saw really struggled were the people, of course, who didn't ADHD, who didn't seem to fit in any of those, right?
Right.
So that was something that sparked them. You sparked my thoughts, so appreciate that.
Yep. And that's exactly what happens. And anybody who has worked with kids who struggle, if they can't find a place where they belong, they sometimes find their way to groups that are maybe not so pro-social, and they will find a place where they'll fit in, even if it's not such a great place to fit in. And then we have like a whole nother series of issues where maybe substance abuse starts to enter into the picture. And so yeah, that's and I think that it also becomes an issue for adults with ADHD, even in the workplace. How if you're an adult with ADHD and you struggle with time management and you're always late for meetings, or you always late on with your paperwork, and you kind of struggle with those sorts of things. What does that mean for you in terms of your career and meeting expectations? And those kinds of things will carry throughout your life. Hopefully that over the course of your life, you kind of learn to manage that a little bit better. You have a better frame of reference than a 12-year-old does. But it still can be a really challenging experience because we're all looking to fit in and belong and do well. So thank you. Thanks for adding that. I appreciate that.
Thanks for the additional context.
Yeah. So anyway, one of the things that I was reading too was, let me find my place here. People with ADHD will often talk about like we were talking, not belonging anywhere, that they don't fit in, that they can't connect because they have this internal experience that's very different from other people. One of the things that I was reading when I was watching some YouTube videos about people's personal experiences with their diagnosis, and one of the things that came up a lot was this feeling of, being told that they're too much, too loud, too boisterous, too late, too something, and this idea that um, they're this big, but they need to fit into this, the square peg that needs to fit into the round hole. And when you try to put a square peg into a round hole, it just ends up chafing and hurting a whole lot. And so that was a really sort of powerful thing to hear this woman talk about her experience of feeling like too much and having to be smaller in order to fit in with the world. One of the other thing, this was another adult who was talking about their diagnosis, and they were talking about their diagnosis within the context of marriage. And some of the messages that he heard was, if you cared enough, you would remember this. If you, cared enough about me, you wouldn't forget to X, Y, or Z. If you cared enough, that somehow there is this correlation between you would be able to overcome your ADHD symptoms if you loved me and the kids enough. And that's just not how that works. That would be great, if somehow love had this magical ability to conquer all, no matter what diagnosis we have. But unfortunately, it doesn't. And that's kind of the sticky part, I think, with ADHD, because it's not a typical mental illness. It is, it still has this strange context of this is something that children have and not something that, your husband or your wife has. And yep, he forgot to pick up the kids, or she forgot to take out the garbage for the third week in a row, whatever it is. And that it's not this purposeful mindlessness. It's really a symptom of ADHD. And we talked about the peer victimization, whether it's as a child, adolescent, or even as an adult. The other thing is the generational trauma that goes with ADHD. ADHD often goes in family lines, and there's a lot of different reasons for that. There's a genetic component there, but then there's also generational trauma. And Gabor Mate he's a psychiatrist from Vancouver, and he has a different theory about ADHD that's interesting to me, that he really feels that it's much more trauma centered. He wrote a great book about it. I can't remember the name of it, Scattered something. Anyway, so there are a lot of different theories about, why. Talk about scattered thoughts, because now I'm thinking 6 things at one time. So anyway, so it travels in families, and so sometimes that can make it more difficult too. If you have a child who has a really supportive family, who's able to kind of surround them with all the resources and support and love, then like any child, they're going to do well. But if you also have a child who is in a family with parents who are also struggling with ADHD symptoms, or they've not developed any compensatory behaviors, and there's a lot of impulsivity in the house, it makes it much more difficult for that child to learn that over time. So that becomes more difficult as well. One of the things too, I should have put this statistic a little bit higher up, is about 50 to 60% of people with ADHD have a learning disability, which kind of adds to this layer of not feeling like they fit in and feeling like a burden, that they work so hard. And I remember my brother really feeling like this, because there was a delayed learning in terms of his reading. He really struggled to learn to read, but once he got it, he got it. But there's still that little bit of a belief that why didn't he learn it faster, sooner, or with his grade? Does that mean that I'm not as smart as other people? Am I, is there an imposter syndrome there? I have to work harder to keep up with everybody else. Does that mean that I'm not as smart? And so these kind of thoughts that end up happening in people with ADHD can sometimes really lay heavy on a soul. So the last big thing that I wanted to talk about that was really interesting, and I had not really thought about it, is Joyner talks about what is it that overrides our natural born fear of dying. Generally, humans are made to survive, but what happens, and this is within the context of ADHD, what happens for people with ADHD that people go over that hump and that fear goes away? And it's really interesting because we know that ADHD, that there's a deficit of dopamine in people who are diagnosed with ADHD. And so what tends to happen is people with ADHD do a lot of thrill-seeking behaviors in order to kind of get that dopamine hit. And what a lot of the research is finding that people who are struggling with suicidal ideation are practicing internally suicidal actions because they're getting a dopamine hit from it. And it's what I was reading was that people are almost getting soothed by it because it feels like the practicing and the mental practicing feels like preparing for the future, and that it feels safer just knowing that you have a plan, but you're also getting that dopamine hit of knowing that there's an exit plan at some point. And they were talking too about how self-harm works as a practice too, because you're slowly sort of habituating oneself to the potential pain of death. And the more you habituate yourself to it, the more ready you are. So whether it's the thrill-seeking behavior that comes from the impulsivity that's natural to ADHD, the self-harm behavior, which helps you just habituate yourself to pain, the deficit in dopamine, there's this tendency to slowly build yourself up to the potential of taking one's own life. And that was a little bit scary to me too. And obviously, not everybody who has ADHD is potentially going to take their life, but I do think that it warrants something to look at. The last big statistic that I want to talk about, and this one was really surprising. If somebody who has ADHD self-harms, there's a 100 times more likely chance of them attempting suicide. And that was really, really surprising for me. So, you know, I see all adults now. I maybe have two or three later teenagers that I see as clients. But to think about how many clients we have that self-harm, even as adults, I think that it would be an important thing to assess. Do you have ADHD? Because if you're a self-harmer and we haven't assessed if they have ADHD, but we now know that if you self-harm, you have 100 times more chance of dying by suicide. That needs to really be part of our regular assessment process. Yeah, so in short, that's kind of what I came up with for the presentation today. I just kind of wanted to give a brief overview. I didn't want to talk too much about suicide or suicide risk factors. I know we talk about that stuff all the time, and I just wanted to go over the very basics of where ADHD and suicide meet, and why it's very important that we add it into our assessment process. Yeah, does anybody have any questions?
Thank you, Christy, for excuse me, for your presentation this morning. I, for one, found it to be very interesting. I'm curious, it struck me when you were talking about kind of the way that, you know, we see and we're more familiar with perhaps how children with ADHD might struggle in the classroom, but there's often not a lot of thought or effort around helping adults with ADHD to fit better into a workplace environment. at least from my perception and what I've experienced, right? And I'm just curious your thoughts on that, or if you've heard of any good HR policies or programs that help out with that in any way that you think are effective.
I haven't. We all know about mental health TikTok, and it gets a lot of. There's been a lot of discussion on mental health TikTok about trying to accommodate the workplace, and some of the accommodations can be a little bit out there. But I have not heard of any accommodations because, I'm not real sure how to make that work, especially when billing is an issue, or getting notes done in a timely fashion is imperative. I'm not real sure what the answer to that is. I know that it continues to be an issue, and I think that there are a lot of therapists are transitioning to coaching now just because they're avoiding managed care. And one of the things that I am seeing are people who are working as ADHD coaches, and I think that has been helpful for people in the workplace. What do you need to do to manage your time better? What do you need to do to manage your tasks better, so that it's not necessarily relying on your workplace? Because sometimes their hands are tied, but what does an individual need to do to develop some skills to manage those things better? But in short, I've not heard of any HR department doing anything specific to help adults with ADHD.
Yeah, thanks for that insight, and that's interesting. I've also heard a little bit, or seen advertisements, I guess, or heard advertisements on the radio for coaches for that purpose. So that's interesting.
Yeah.
And you would say that's a relatively new thing?
Well, I wouldn't say that it's new, but I know that more and more therapists are making the switch to coaching just because of just all of the difficulty with managed care and licensing across state lines. And so it's been it's much easier to practice in lots of different ways. That could be a whole soapbox. I could do a whole nother hour just on that topic. Yeah. And so a lot of therapists are making that switch to coaching just because it gives them a little bit more freedom to practice in the way that they would like to practice without some of those external rules.
Yeah, I think it's an interesting conversation just to have about workplace environment for people with ADHD or other mental health diagnoses, right? And it's interesting to me to kind of hypothesize about maybe where this might go in the future with, HR maybe establishing more guidelines that specifically speak to these kinds of things. Because I know when we talk about like diversity and inclusion within PERU, and we tend to be on the more forward-thinking side of things as far as like current conversations that are being had generally. But, we talk a lot about like neurodivergent thinking, and, there's a lot of things that could be framed as very positive about ADHD, right? If you have the ability to hyper focus on something or to consistently think outside the box, some people can't do that at all.
Right.
And so that's really advantageous in certain workplaces, right? And so really kind of trying to, again, move toward this idea of people as holistic individuals who have, things that they're talented at and things that maybe they're not so talented at, and really trying to figure out how that works.
I totally agree. I think that, would be wonderful. And I think, the same thing with schools. It would be great if schools could cater to everybody's individual learning style. But that's an insurmountable task. But in the workplace, it's a much more manageable thing. Absolutely. We all have skills that we're great at and skills that we're not so great at. And then how does an agency, a company cater to that so that everybody is more successful, instead of trying to fit everybody into the same expectation, knowing that there's going to be shortcomings.
Exactly. Yeah. Does anyone else have anything to add or any other questions that you want to ask Christy before we wrap up?
Good morning, Christy. How are
Hey,
you?
Greg, how are you?
I'm good. I'm good. I do have a quick question for you about, I guess, a sort of connection between things like imposter syndrome, um, workplace performance, and I guess um, workplaces and places in general, systems in general, are designed to be so rigid, right?
Mhm.
Um, how, when we're thinking about how to navigate these systems, and we're thinking about this idea that, I don't know, imposter syndrome is a thing that people have and other people don't recognize.
Mhm.
How does the person who is living with ADHD, um, how do you articulate that to your peers, to your coworkers, and things of that nature? I know this is a little bit more of a personal question, but I guess from your perspective, how do we get that across more clearly?
In what direction?
Just the
Get
direction of
to the person with the diagnosis that they are competent, or get that across to the coworkers that there might be a fear that there's an imposter syndrome.
I guess I'm kind of looking for some language around, people say imposter syndrome all the time, but
Yeah,
I've never heard it really associated with ADHD until this morning,
yeah.
which is, something that's probably is I missed on my part, but just wondering, like, what ways do we talk about these things to our peers if we are struggling with ADHD and just happen to have things like imposter syndrome, etc. I don't know.
Okay.
I don't know if that makes sense, but
Like from a more so it sounds like you're asking from a more personal, you're trying to explain like, hey, this is what,
if
because
I'm
it's
advocating
coming from a place of self-doubt, really.
for themselves, sorry.
Yeah. So because you're right, imposter syndrome is, kind of a catchphrase that kind of gets thrown around a lot these days. But it just kind of comes down to this self-doubt. Um, this inherent belief that a person isn't, that they're going to be found out, that they're going to be found out that they're not as smart or as competent, or that there's going to be this magical day where, that the people that they work with, or that their boss is going to figure out, I don't know how you got here, but you just snuck in under the radar, but you are not the right person for this place. And I think that I'm a therapist, so I think everybody has a certain belief, because I hear it all the time. Um, I don't know. I don't know what the answer to that would be. I think it would be very personal, depending on each individual person. Just kind of being able to be authentic and say, I'm not real sure. Um,
Yeah, and
Uh,
I guess I'm thinking, the reason I asked this question, if I can be just real upfront, is I was,
yeah,
I've been following closely the story of Dr. Antoinette uh, Candia Bailey over at Lincoln University, Missouri,
okay,
the dean who died by suicide
okay,
at the university, and my reason for really bringing this up is because, I mean, from everything we know, she had been pushing for recognition of her, you know, mental health issues. She felt like the president bullied her. Her
oh,
parents didn't recognize that she was actually struggling with, and I'm not entirely sure what her diagnosis was. I think it might have been depression and anxiety, or it could have been any combination of things, right? But my question really is around, like, this idea that when people do present themselves, it's such a vulnerable thing for
mhm.
them to do that. And then a lot of the time we do this and we don't get the recognition that's due, or we get pushback, or people just don't believe.
They just don't believe. You're right. And that's not even just about, specific to ADHD. That's just the conundrum of being vulnerable enough to say, I've been having these thoughts, or this is what I'm struggling with. I think people who have never had suicidal thought, it is so incomprehensible to them that somebody could think that they just don't take it serious when somebody says, hey, I've really been having these thoughts. I really don't want to be alive anymore. I think they think it's hyperbolic, you know, in the way that just somebody is just kind of like blowing off steam. And so, and I think that people are also really uncomfortable. They don't know what to do. They don't know what to say. And if they don't know what to do and say, then they don't say or do anything.
All right, Sam, real quick, if you have a question or a comment to add, and then I think we're going to jump off just to be respectful of people's times. We are at 9:45, so.
Oh, yeah, thank you, Patty. Yeah, so to kind of piggyback off of Greg's comment, and maybe you could speak to this a little more, Christy, is that the discussion around imposter syndrome, I think, is sort of pertinent as I've sort of heard of it through narrative therapy, especially for those who suffer from PTSD or PTSI. And so I think there's certainly power in understanding the therapeutic effect of like narrative therapy, or being able to reframe you know, a trauma or an incident where you're not necessarily you know, putting yourself in a situation where you feel like you don't deserve help, so you don't ask for help. And to if maybe any of the ADHD cases that you've encountered have also had instances where you've also had to navigate through imposter syndrome, but also sort of like the self-doubt that prevents a lot of victims from coming forward when they have a PTSD related injury, such as military sexual trauma.
Yeah, and I think that goes into Joyner's a theory of suicide and that burdensome component, where if somebody doesn't want to be an added burden to somebody, what does it mean to say to people that you love and care about, I want to end my life? They already feel, usually when somebody is really struggling with suicidal ideation to begin with, they're already feeling like a burden in general. And then to add on an extra burden of saying, hey, I'm struggling with X, Y, or Z, it's really, really a difficult burden to bear.
All right. Well, thank you all for your participation. Christy, thank you again for this awesome presentation. I think we had a pretty good discussion about it too. And for all of you, there'll be an email probably coming out probably following our AG meeting this month, but we recorded this morning, and so we're gonna post this video on our website and possibly have it linked to the newsletter. We'll see what Laura comes up with, but it will be accessible in the future, and we'll let you know when and where that is. And I hope everyone has a great day. Thanks for joining us.
Thank you again.
Thanks so much.
Thanks, Christy. Bye, everybody.
Thank you. Bye.